Now, this is where things get a little bit interesting here. You guys have heard of Event 201. Have you heard of this? Let me just give you a little synopsis. So in October of 2019, so this past October, the Johns Hopkins Center for Health and Security hosted a pandemic tabletop exercise called Event 201. And you can go to the site, you can read about it. With partners, and let's just hear who the partners are: the World Economic Forum, the Bill and Melinda Gates Foundation, the CIA, the World Bank, the Chinese Center for Disease Control, and who are the other characters on this thing? Bloomberg as well. Bloomberg was in on this too. So this was non-governmental agencies coming together to do a test. It's called Event 201. It was done in October of 2019. So for the scenario, this is them saying, for the scenario, quote, we modeled a fictional coronavirus pandemic, but we explicitly stated that it was not a prediction. Okay, so hold on a minute. So you created you created a test, okay? You were gonna do some kind of exercise to test pandemic measures or whatever. You modeled a fictional coronavirus pandemic. Of course, there are many different strains of coronavirus. All right. And but don't worry, guys. We explicitly said it wasn't any kind of prediction. It was just we were just doing some tests, and then just coincidentally the thing happened. We've seen this how many times? How many times? 9/11, day of the thing. They're doing exercises of the exact scenario while the real scenario happens. Just how many times have we seen this? Okay, I'm not saying anything. I'm just saying that's interesting. And although our tabletop exercises included a mock novel coronavirus, the inputs we use for modeling the potential impact of that fictional virus are not similar to the coronavirus CoV 2019. So there, of course you're going to backstep and say that. You're like, oh, well, yeah, it wasn't exactly like the coronavirus that's just out, a couple months later was going to spread around the world. It's a good thing we ended up doing this exercise to practice dealing with pandemics. Let's see, several of the occurrences of the CoV 2019 exercise coincided with what really happened. In the Event 201 simulation of a coronavirus pandemic, a 15% collapse of financial markets had been simulated. Another interesting point is that in 2017, the World Bank launched its first ever pandemic bonds to support $500 million of pandemic emergency financing. So they basically created a bonds facility to help deal with any kind of pandemics. This was in 2017. It's just a quick little snippet from the article. So today launched specialized bonds aimed at providing financial support to the pandemic emergency financing facility, a facility created by the World Bank to channel surge funding to developing countries facing a risk of pandemic. This marks the first time that World Bank bonds are being used to finance efforts against infectious diseases, and the first time that pandemic risk in low-income countries is being transferred to the financial markets. So they're like, hey guys, it's about time that we have the World Bank, okay? This isn't something that's done within each nation and decided upon in that way. This is the World Bank that is creating funding, of course, to set themselves up as the saviors, right? Whenever this thing breaks. So, I mean, do you find that interesting? Am I just crazy for thinking about how coincidentally you have the World Bank setting up these bonds, 2017, October 2019. We have some very interesting organizations coming together to do a mock test of exactly what is happening right now. And if you actually go and look at the test, and I don't have hours and hours to break it down all the details, you can go watch all the videos. You can watch them at their conferences talking about it. You can read the documents on it, and you look at what happened in the test, and then you compare that to what's happening right now with the coronavirus. It's just interesting. It's like something out of a movie.
If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war. Not missiles, but microbes. Now, part of the reason for this is that we have invested a huge amount in nuclear deterrence. But we've actually invested very little in a system to stop an epidemic. We're not ready for the next epidemic. In fact, let's look at a model of a virus spread through the air like the Spanish flu back in 1918. So here's what would happen. It would spread throughout the world very, very quickly. A worldwide flu epidemic, global wealth will go down by over $3 trillion. And we'd have millions and millions of deaths.
There are strange facts surrounding the coronavirus outbreak of 2020. In 2018, the Purebright Institute was granted a patent for the coronavirus. The Purebright Institute is funded by the Bill and Melinda Gates Foundation. On October 18th of 2019, the Bill and Melinda Gates Foundation, along with Johns Hopkins and the World Economic Forum, hosted Event 201, a high-level pandemic simulation in New York City. The simulation, which was held just 3 months ago, was based on the coronavirus. They concluded that it could kill 65 million people and decided the solution was to have a vaccine within months of an epidemic. The same week that the coronavirus makes headlines, Netflix releases the docu-series Pandemic: How to Prevent an Outbreak, wherein the solution is vaccines and the trusted hero is Bill Gates. Meanwhile, the Bill and Melinda Gates Foundation fund Inovio Pharmaceuticals, Inc. to develop a coronavirus vaccine. It's weird, right? Or am I just a conspiracy theorist? What about this? 5G, an emerging technology upgrade that has many countries concerned about its impact on human health. Experts from all over the world warn of the dangers of 5G. In 2018, it was reported locally that Wuhan would be the testbed city for full 5G network operation in China. The article went on to say that it would be fully operational by 2020. And on Halloween of 2019, they turned it on. Scientists warn that 5G causes flu-like symptoms. Interesting? What is also interesting is that when trying to share the link of 5G being launched in Wuhan, Facebook blocks you from doing so because it violates their community guidelines.
I would like to tell everyone something about the coronavirus epidemic that we are allegedly having right now. First, I thought the hype was going to end again, but it's increased so much, we finally have to start taking a closer look. I worked as a doctor and conducted a health department. I had my own Sentinel, my own system for monitoring flu diseases. And every year I observed how many people became sick in an area of 150,000 inhabitants. Every year, worldwide, we have new types of viruses, because the viruses have to change themselves. If the same viruses came year after year, our immune systems would recognize them, so they would not be able to make us sick or to multiply, which is what they want. So they regularly have to change a bit, and that's why we have new variants of these viruses every year. There are about 100 different types of viruses that are changing constantly. Up to now, we really didn't care which viruses caused this flu or disease or however you want to call it. But there have been investigations for several years in Glasgow. There, they tried to use the available tests. That means they didn't examine all 100 types, just the ones they had tests for. So they looked at maybe 8 or 10 different viruses, and coronaviruses have always been part of them. These are the figures from Glasgow. Starting from 2005 to 2013, they checked which viruses occur among respiratory diseases. and these colored columns are the viruses. The green part refers to the coronavirus that was always part of the mix. The coronaviruses normally make up 7 to 15%, maybe 5 to 14%. It always fluctuates a bit. Hence, it's just normal that a big part of viruses are coronaviruses. So the following happens. In Wuhan, there is the biggest safety laboratory for viruses in all of China. So there are a lot of experts on the topic dealing with it all day long. Wuhan is a big city, 11 million inhabitants, big hospitals, big ICUs, always people being ventilated, people with pneumonia, hundreds of them. And they did tests with a few patients, less than 50, looked for viruses they had and examined their RNA in the lab, and they found a new type. This attracted their attention. When a virologist finds something like this, he puts it in a global database. And this database is accessible for scientists all over the world. In Berlin, for example. In Berlin, they checked and compared this new entry and tried to create a test to measure this new variant of coronavirus. Then Mr. Drosten submitted a protocol to the World Health Organization, and it got admitted really quickly. Usually, as a test is considered a product of medicine, it has to be validated. That means it has to be checked very precisely. What does this test actually say? What does it measure? The mentioned test is an in-house test developed in the Charité clinic, but because there weren't any validated tests and the great panic arose, it was decided to just use this test everywhere. And then Mr. Drosten provided the test. Of course, the virologist can't say if the virus is dangerous or not. He can only say, this one is different, or we have a test for this. But is the virus dangerous, Mr. Drosten? How is he supposed to know? He would need further epidemiological data based on observations of how sick the people are. How fast do they get healthy again? Are there less victims than before? That's why it's important to look at the data from previous years to compare them, to look at the mortality rates to see how many people died of the virus. So while looking for a specific virus, for example, the coronavirus, you can examine the total population. What you will find is that presumably around 8 or 10% of the population will have some kind of virus that makes them sick. But if you examine medical practices, do your tests there to determine who is sick, then of course you would find a lot more positive cases. And if you examine hospitals and take samples there, then you would find even more corona-infected people. That is to say, depending on which proportions of the population you examine, whether it is the whole population, patients in the waiting room, patients in a clinic, or when you examine very ill patients in the intensive care unit that are about to die, you will expectedly find these 7 to 15% coronaviruses every time you do a test. However, if they die of the coronavirus or of another virus while just having also corona, that can't be determined for sure. So when you look at the death rates in Italy, you want to know where the tests have been taken, where and how have these few available tests been used. If they were used in a hospital on serious or terminally ill cases, then obviously the corona death rates rise. It gives the appearance of being high because of the specific group that was examined. Mortality, disease-specific mortality, refers to the percentage of dead among the people infected with this disease. And concerning the seasonal acute respiratory disease, commonly known as the flu, there is a mortality of 0.1%, which is already the maximum. That means that 1 in 1,000 flu-infected inhabitants dies every winter. So now we will have to see whether this number increased because of coronavirus. The assumption for Germany is that there are 20,000 or 30,000 more deaths than without the flu. This is called excess mortality. So now we know that coronaviruses always make up 5 to 14% of all flu viruses, let's say 10%. Let us assume in the previous years we tested all seriously ill patients in the hospital on the coronavirus, which of course didn't happen. We would have expected to find 2,000 to 3,000 people dying of a flu each year that also had the coronavirus. And we are still far away from those numbers. Apparently, it is the case that virologists created something very sensational here. And with their creation, they really impressed the Chinese government as well. The Chinese government made something really big out of it. Suddenly, this was a very important politically, completely exceeding the virological frame. All of a sudden, face recognition was installed everywhere at the airports. Fever was being measured. The clinical thermometer controlled the traffic on the Chinese streets. And all of this was so significant that it led to international consequences. Politicians had to deal with it, had to take a stand. Then the virologists came into play again. The governments asked their own virologists, and they confirmed that this virus is a thing to worry about and proposed to develop tests to help measure the virus, like in China. Something was woven around this. A network of information and opinions has been developed in certain expert groups, and the politicians turned to these expert groups who initially started all this, and they really absorbed this network and moved within it. This led to politicians who now are just resting on these arguments while using these arguments to evaluate who has to be helped to determine safety measures of what has to be permitted. All these decisions have just been derived from these arguments, which means that now it's going to be very hard for critics to say, stop, there is nothing going on. And this reminds me of this fairy tale about the king with no clothes. And just a small child was able to say, hey, he is naked. All the others on the courtyard surrounding the government and asking the government for advice because they can't know themselves, they all played along and joined the hype. And like this, politicians are being courted by many scientists. Scientists who want to be important in politics because they need money for their institutions. Scientists who just swim along in this mainstream and also want their part. We can help too. Oh, we made an app. Oh, we have a program for this. So many people saying, hey, we want to help too, because they want to earn money with it and become important. And what is missing at the moment is a rational way of looking at things. We should ask questions like, have you found out that the virus is dangerous? How was it before? Didn't we have the same thing last year? Is it even something new? That's missing. And the king is naked.